Let's go. Good afternoon, Raymond Meneses from Legal Management Services. How are you?
Very well, thank you. Very well indeed. Glad to be here.
Excellent. It's another great opportunity to engage with you. There's been some good conversation. I just maybe wanted to pick up with you from a question that I had from our previous webinar. Sorry. One of the outcomes to that potential dispute with employees, where
Yes.
employees have the right to refuse work, where they believe that they could be exposed to COVID. The legislation refers to mediation as well. It's one of the questions that I had from last time. Is there a legally required mediation? Obviously, I know through the Department of Labor, I know that they are available for mediation in those instances. Can you seek outside mediation as well? Because I know you do a lot of mediation.
I do, thank you. So the Act anticipates that it's referred to arbitration, and the preceding process before the arbitration is conciliation, which is conducted by the CTMA. But the provision also anticipates that the parties should seek to resolve the matter internally first. And a very good way of doing that is through mediation. Absolutely, there's scope for mediated solutions in these circumstances. And the benefit of a private mediation is that it's immediate. You can get it done that morning, that afternoon, that day.
Yeah.
Because otherwise, there's a risk if one guy says, I'm not prepared to work, other employees might down tools, and then you've got potential of unprotected industrial action, and there's a debate about whether it is in fact unprotected industrial action, and you can have a closure which is going to cost money. So absolutely, mediation is a very effective way of resolving the impasse.
Excellent. Thanks. That's a great response. So anyway, to the topic at hand, you and I are going to be discussing today what to do if somebody is identified in your workplace to be COVID positive. So if you give me kind of a minute's worth of latitude, maybe I can just frame the question for us. I believe that an emergency plan is going to be hampered if you haven't had an effective plan in place, an effective mitigation strategy. So if you haven't been tracking and tracing, if you haven't had the various different controls in place, if you haven't had your employees where possible working in clusters, the enactment of any emergency plan to deal with individual or multiple infections in the workplace is going to be very difficult to deploy. So I think before we respond to what should be done in the event of an emergency or a COVID positive case, we have to amplify the fact that without those precursor conditions and mitigation strategies in place, what we're going to mention this afternoon can be very difficult to deploy.
Absolutely right. So just to reiterate that and to maybe underscore the point, every employer should have undergone a risk assessment before reopening the enterprise, and every employer is obliged by law to have a workplace plan. They call it different things: standard operating procedures, risk plan, but effectively a plan that outlines all the strategies of that business in relation to how it's going to effectively implement social distancing, sanitation, and protocols. So in the discussion you and I are going to have now, we're going to assume that all of those things are in place.
Absolutely.
If those things are not in place, the problem is greater than the person who's infected in front of us.
Yeah, absolutely. So let's play it through. An employee is identified as being COVID positive within the workplace. So let's maybe play a scenario through. The person came to work, was exhibiting some form of symptoms, was unaware, they had a slight fever, etc. So the person's now come in through your gate or has been working there for a while, but then is seen to have some symptoms. One day when he pitches up to work, he's sent away for a test and he is identified as being COVID positive. What next?
So just to start with, employers are not testing whether employees have COVID.
Absolutely.
They're simply assessing whether they're symptomatic, potentially symptomatic, and that's, as you pointed out, identified with a fever, dry cough, and other indicators. So once a person is symptomatic, whether they arrive at work and they're symptomatic or the symptoms develop during the course of the day, the same protocols apply. The person, if they've just arrived, is not permitted to enter the workplace or to commence working. If they're already working, they are to immediately be isolated, which means that they're taken away, given a surgical mask,
Correct.
asked to not have contact with anybody, and let's say it was a fever, they will then be reassessed, say 10, 15 minutes, and then again, potentially, just to see whether in fact this was a fluctuation in temperature not ascribable to a fever. So the critical thing is that they should be isolated, and there should be a designated area where they're taken to, where everybody knows that's where you go while you wait for the second screening. They should also be counseled. They should be told, look,
Absolutely.
you're going to go to the second screening. This is the process.
It can be traumatic.
It can be traumatic. And you don't want the employee to panic, potentially have some kind of panic attack or escalated blood pressure, start exhibiting additional medical symptoms that you now have to weed out, apart from the fact that it's not a good thing to do to your employees. But you don't want to have complications. You want to keep the thing simple. So you counsel, you tell them exactly what's going to happen, exactly what the protocol is. They should already have been educated and informed on this, because part of every workplace plan is a detailed education process and regular reminders to all employees of what the protocols are, what the processes are.
Sure.
So this should not come as a surprise to them at all.
Correct.
Also, and this appears further on in the regulations, the employer is obliged to take appropriate measures to ensure that an employee is not discriminated against. Because the disease is potentially deadly, there is a risk that an employee who's exhibiting symptoms may be abused by colleagues. And it's important that the employer takes appropriate measures to ensure that doesn't happen, even in the screening process.
Sure.
There's that. So they're isolated and they're given a surgical mask. One of the potential shortcomings of the new direction is that whilst a cloth mask is fine, a surgical mask is not. You've presented on the different forms of masks, N95 and others, and you've explained what a surgical mask is, but there are, certainly in terms of the regulations, there isn't a standard. So I would be interested to hear what you would have to say on what, in your view, constitutes a surgical mask that complies with these regulations.
Sure. Well, one of the interesting points is I note one of the first directives that came out from the Department of Labor said that when the person is isolated, they should be given an FFP1 mask. Now, remember, we've already spoken about FFP1, FFP2, FFP3, and I thought, well, that's quite interesting. Put it this way, I would definitely advocate for an FFP1 mask over a cloth mask any day, because it has some form of testing that is performed. My suggestion to any workplace would be that the employer provide an FFP2 or a K95 mask to the employee until such time as they can be taken away for testing, etc. But while you were talking about that, we need to take cognizance of the following, that the place where they are isolated is then going to be a focus point for your sanitizing when you're cleaning up. And also there would be imperative for the employer, because you've got a potentially COVID positive person within that environment, to ensure that there is suitable ventilation, etc. There's a whole load of things that now need to be considered in terms of the isolation venue for this person. It shouldn't be a closed up area that multiple people have then, so it shouldn't be in a passageway that people are walking past. It should be, as the term goes, some form of isolated area.
Yeah, absolutely right. Because the very next thing you have to do once the employee departs, not departs.
Oh, yes, not that departure.
Leaves the premises, is the area has to be disinfected. So you want to keep that area as small as possible. And you also have to clear or disinfect the employee's workstation if the employee went to the workstation.
Yeah.
And immediately undertake contact tracing and find out on that day immediately who that employee has been in contact with.
Yep.
And have that information available and encourage each of those employees to really be vigilant about their social distancing for the day.
Okay.
They may, in fact, those employees with whom the employee has been in contact may be required to be screened and tested. Obviously, the challenge is that the symptoms are not going to be immediate. There's quite a long incubation period. So you have to have a record of who that is and then engage in appropriate testing a little further down the line and keep an eye on them in case they become symptomatic.
Sure. So let's just talk that for a while. You've identified a person who's exhibiting symptoms. The scenario that we've played through, you're not 100% certain that the person is COVID positive. They are exhibiting symptoms, etc. Now, we've sent them away. We're already sanitizing that immediate area, sanitizing their workspace. Now, the confirmation report comes back from the healthcare provider, the hospital, the laboratory, that it's now confirmed that the person is COVID positive. Now there's a whole load of communication criteria that need to kick in. The NCID, Department of Health, Department of Labor, all of these various government resources now need to be pulled in.
It's mandatory to contact the NRCD and the Department of Labor, or Employment and Labor as it's now called, and the Department of Health, and report it and say we've had this person. A representative of the Department of Labor or Department of Health is likely to then approach the employer in the next few days to conduct contact tracing. So that's the theory. We'll see how it works out in practice.
Sure. So now, and this is a discussion that you and I have had at length, this now needs to be reported to the Department of Labor. This is potentially a reportable incident under Section 25 of the Occupational Health and Safety Act. It's a diagnosed case by a medical practitioner. You've now got to initiate a potential Coid claim. Now, to elaborate on that, I would like to say that the employer has the right, they cannot repudiate the claim, but they have to then submit associated evidence if they believe that the COVID infection didn't take place in the workplace. Because we've already spoken about that causation, being able to identify causation in my mind is literally impossible.
Yeah, well, it's interesting that the way that the direction that was issued on the 4th of June deals with this says, if there is evidence that the worker contracted COVID-19 arising out of and in course of employment, they must lodge a claim. So it appears that at the very least, before you can lodge a claim, before a claim is required to be lodged, there must be evidence that the contraction took place at work.
Yes, but I mean, therein lies the quandary.
There is the quandary, but it seems to me that an employee wouldn't be able to say, well, I must have got it at work, because where else could I have got it? And the employer says, well, there's nobody else at work who has tested positive for it. We have all of our protocols in place, on the one hand. On the other hand, we know that you live at home with several people who make use of public transport every day. You make use of public transport every day. It's a much higher likelihood that you contracted the disease outside of the workplace. Give us evidence, because that's what the document requires. That's what the regulations require. Give us evidence to support a claim to go to Coid. Now, bearing in mind, as you correctly point out, you're 100% correct, the employer isn't empowered to repudiate any claim, occupational health claim, on behalf of Coid. We just don't have that right. But it does appear in terms of the regulations that the employer is only obliged to report it as a COVID claim if there's evidence that the worker contracted the disease.
Yeah. So the investigation has to kick in. And here, obviously, this is where the health and safety professionals, consultants, or whoever they're dealing with at work, then need to initiate an investigation, identify if there have been other people at work, who they've come into contact with, etc., and also the effectiveness of the controls. So that would all be additional evidence that could be submitted by the employer to bolster their case if they felt that it wasn't contracted at work.
So if I could then move along, the question is, we've conducted the test, the investigation. We found that there were no obvious flaws in the workplace plan or in the risk assessment. So there's nothing to be done from the employer's perspective. Obviously, if there are flaws, then we need to address those flaws. But assuming that there aren't any, when can an employee who's been diagnosed as COVID positive return to work? So what the new direction says is that if a worker has been diagnosed with COVID-19 and isolated in accordance with the DOH guidelines, an employer may only allow a worker to return to work on the following conditions. In other words, the default position, an employee who's been COVID positive can't come back unless these criteria are met.
Yeah.
And that's quite a big deal, because I think what's going to happen is employees who test positive and may be asymptomatic or have mild symptoms and who've exhausted their sick leave may want to come back earlier than the regulations permit.
Yeah.
And the employer may not permit the employee to return in those circumstances. So I'm going to run through what the criteria are now for an employer to be allowed to permit an employee to return to work. First is the worker has completed the mandatory 14 days of isolation. Now,
Correct.
those 14 days aren't dealt with in the regulations or in the direction, but they're dealt with elsewhere in the NICD and in previous statements released by the Department of Health. The 14 days refers to the day on which an employee became symptomatic, if it's a mild case, or if the employee had a severe case and received therapeutic oxygen as part of the treatment process, 14 days from the last day on which therapeutic oxygen was administered.
So a ventilator.
Ventilator, exactly right. So it does require quite a high degree of engagement between the employer and the employee to assess what they're dealing with. And in my view, the safest route would always be to get a medical certificate from a medical practitioner to say, this was a moderate case, this was a severe case, this is the date on which the person was symptomatic, this is the date on which the person last received ventilation, and they're cleared to go back to work.
Sure.
Which takes us to point 2. Secondly, the worker has undergone a medical evaluation confirming fitness to work if their worker had moderate or severe illness.
Sure.
That's not if they were asymptomatic or mild symptoms, but severe.
So they obviously didn't end up on a ventilator.
Correct. And that assessment doesn't mean that they have to be assessed and found COVID negative. That's really important.
Correct.
It simply is an assessment that they're fit to work.
Yeah.
The third one is that an employer must ensure that personal hygiene, wearing of masks, social distancing, and cough etiquette is strictly adhered to by the worker.
Yes.
And like, that's difficult because how does an employer ensure that an employee coughs correctly? All you can do is educate and inform, and then take appropriate measures if they don't.
Yeah. My concern,
there has to be a degree of supervision there.
Yeah, my concern here would be the stigmatization of the person returning to work, albeit not symptomatic, still possibly. Well, that's where the argument, and I think that's where the occupational health practitioners need to jump in, is are they still infectious? Because I don't think that they would have allowed them back. They might still be wrestling with the disease, but perhaps they're not infectious after that particular time period. And one would assume that the directive was based on sound occupational health principles. But again, this is another key point that an employer would need to educate employees on. Otherwise, people who are returning to work who have been COVID positive are going to be pariahs.
Yeah, exactly right. So if you look at the Annexure A, the direction, there's a list of links, which are very good actually. It's a great resource to the Department of Health, to NICD, World Health Organization, and others on how to actually do this stuff and the considerations that apply. So it does appear that the Department of Employment and Labor has done a fairly detailed job on setting out what the criteria are to minimize risk. And then finally, 28.5 says the worker must wear a surgical mask for 21 days from the date of diagnosis, which is a departure, incidentally, from all the other protocols, where it's 14 days from the symptomatic or from therapeutic oxygen. This seems to be a bit of a random, I'm not sure where it came from, a bit of a random requirement. But I think what it is a practical solution, because the primary function of the mask is to prevent spread from the sick employee to anybody else.
Correct.
So the surgical mask is going to achieve that. Hopefully, should, if they're compliant in its use and observe the other health protocols, they should be absolutely fine from the date of diagnosis, and that's irrespective of whether they're symptomatic or not.
Yeah, correct.
You can be COVID positive and not symptomatic at all.
Yeah.
So anybody who tests positive has 3 weeks, so that's 14 days in self-isolation or in isolation, plus an additional 7 days where they're going to be wearing a surgical mask at least.
Correct.
Okay. Then what about if an employee who's COVID positive has been in contact with other employees? What do you do then? The direction says that if a worker has been in contact in the workplace with another worker who's been diagnosed with COVID-19, the employer must assess that worker's exposure in accordance with the Department of Health's guidelines to ascertain whether the exposure carries a high or low risk transmission between the workers. Yeah. And the guidelines there are the guidelines that were issued in terms of high-risk employees.
Yes.
At the time, they had in mind nurses and doctors. And
correct.
But the same applies.
Yeah.
If there's a low risk of exposure, the employer may permit the worker to continue working using a cloth mask and must then monitor that employee for 14 days. And then if there's a high risk, the worker must remain in quarantine for 14 days. So this is potentially disruptive. And the employer must place the worker on sick leave in accordance with clause 27.3 for that period. And if the person exhausts the sick leave, unless the employer makes a special arrangement, they're then going to be on either unpaid leave or annual leave.
Yeah.
So yeah, those are the practical measures. One of the things I wanted to highlight here is that the compliance officer is required to be appointed, who's a manager, has to own the enforcement of this policy in respect of not only the COVID positive employee, but all the potentially affected employees who come into contact with that. That's a high degree. It's a very responsible position. It's a high degree of monitoring required for that from that manager. If you look at these clauses about cloth mask, monitoring symptoms, and ensuring compliance with all of the protocols, so it's quite a burden. And if you've got one compliance officer with a staff of 600 or 700 people, that becomes quite real.
Yes, absolutely.
So do you have any other questions on that? That's pretty much as I had in mind.
Yeah. So that lays out quite a few of the employer's response with regards to the people in the interactions. I think something else that would be worth discussion as well is what the employer's response has to be within the workplace in terms of sanitizing. Now, some organizations have gone to lengths to bring in foggers and etc. And again, I could potentially argue around the efficacy of those issues. But what any employer would have to do reasonably would be to go around and clean or sanitize everything that employee has come into contact with. So particularly focusing on those high-risk touch points, doorknobs, handrails, the person's taps, the personal computer, the printer, whatever they've come into contact with, their tools and equipment. And that in itself, it's easy to outwork that within an administrative area or within a factory, relatively easy. But when you start looking at construction sites or mines or those kinds of things, we're now breeding into a whole lot of complexity and interaction of people. I mean, I've heard a lot. I sit on a couple of other professional groups where the guys are going, well, you can't sanitize a pick handle. You know, how are you going to clean something like this that is now going handed in between workers? So generally what we've spoken about there is a piece of tool and equipment is issued to somebody, they can clean it, they use it, they obviously sanitize during the course of their work. It's then handed back to the storeman, who then cleans it more comprehensively at the end of the day. So I think employers need to consider that strategy around how they're going to be able to clean up. Now, also that if the Department of Labor is going to then get involved in the investigation, they're going to want the employer to submit suitable evidence to them for them to be able to resume operations. Has the area in fact been sanitized? And I think retaining suitable records of having your cleaning company come in and sanitize and clean, because obviously for a lot of operations, they want to focus on cleaning it as quickly as possible and making sure that it's safe for their remaining employees so that they can resume work as soon as possible due to the massive costs of what one of these shutdowns can cost. I mean, I look at some of the retail stores that were closed down in Belito over the past couple of months. I mean, business closure for them must have cost hundreds of thousands of rands. So some were closed for a week, some were closed for a couple of days. And I think those who wanted to open up quicker, their opportunity to reopen would have been based on the effectiveness of the cleaning program. But I would like to stress this, is if they did their work up front, as in planning and working in clusters, etc., they would be able to clean and resume operations a lot faster. So that's why, right. We focus on making sure that the suitable mitigation controls are in place to be able to deploy this plan.
And on that, you raised such a good point about most employers have outsourced cleaners, and the fact that an outsourced cleaner has been appointed doesn't remove the obligation to enforce the rules. You're still responsible to ensure it's done. So it does involve, in my view, engaging with the cleaning service and saying, look, here are our standards, here are our protocols.
Yeah.
Your work have to comply with these protocols.
Correct.
Because it's your work environment.
Yeah. So yeah, Ray, I think that's been a very helpful discussion. What I'm going to do is obviously we'll package this, we'll get it out onto our social media, and anybody who's listening in on this, if you have any questions, contact us directly. We'll put Raymond's contact details into the YouTube clip and into our social media. If you've got any questions you'd like to ask myself or Raymond, please feel free. Challenge us on our thinking. We're always here to learn, and everything that we share is for the betterment of the general community that is out there. So stay safe, Raymond. Thank you again for your time. And we are meeting again together next week, probably Wednesday or Thursday afternoon, and we'll confirm the topic. Excellent. Thanks again, Ray.
Cheers,
man.